We are here today with Dr. Forkey from the UMass Faces Clinic. And Dr. Forkey, what we'd like to talk a little bit today around parents are some questions that they've really had around the diagnosis of attention deficit hyperactivity disorder and how that relates to trauma, because often they're seeing similar symptoms. Wondering if you could speak to that from your medical perspective.
Sure. So many of the times that we see kids in clinic, the question comes up, does this child have ADHD? And I think those are reasonable questions. A lot of the times the kids are presenting with difficulty in school or difficulty functioning in a classroom setting, or maybe at home they're impulsive or having difficulties with organization. And it makes sense that that's what we know more commonly as ADHD. But it's worth always taking a step back when we know that a child has been exposed to trauma, because the way trauma impacts the brain also will give you symptoms that look very similar to ADHD. So if we think about the parts of the brain that are impacted by trauma, one of the areas is the prefrontal cortex, and that's the part of the brain that's really important for what we call executive function. That's a combination of our ability to control our impulses, to use our memory of what happened before to learn the next thing, and our ability to have what's called cognitive flexibility, sort of take one concept and be a little bit abstract with it to go on to the next concept. But in trauma, the body doesn't really want us to use impulse control or our ability to access a lot of information. It wants us to shut that part of our body off so that we can just respond to the threat. So that for kids who've been exposed to a lot of trauma, the frontal cortex actually is shut down. So their ability to control impulses is limited. So in these kids, in toddlers and preschoolers, will often see that they can be aggressive with other kids or have frequent and severe tantrums, and that can look a little bit like ADHD in the preschooler. They also have difficulty acquiring some developmental milestones or become easily frustrated because of that trauma impact on the brain. Again, in a preschool-age child, that can look an awful lot like ADHD, but in fact is the brain's appropriate response to a situation that might be dangerous. For the school-age child, if we still have that a lack of the frontal cortex kind of being fully engaged, they may have impacts on this inhibitory control where they have more trouble in school and they might be fighting with their peers and disrupting the class. That impact on working memory may mean that they have trouble with picking up school skills and also with organizational difficulties. So that these kids also may be a little bit hypervigilant, meaning they're sort of scanning their surrounding for danger, and it's not inattention, but hypervigilance, meaning looking for danger as opposed to not being able to focus. If we think about it from a teenager's perspective, teenagers are already somewhat impulsive, but if we add to it the fact that that child's been exposed to trauma, their impulsivity may be much more significant, and that can lead to involvement with the law and increasingly serious consequences. Their inability to have sort of this cognitive flexibility means that it's hard for them to do a task that requires them to concentrate on a couple things at once, like working at McDonald's where you have to take an order and make change at the same time becomes very difficult. And then again, schoolwork, keeping it organized, trying to keep up with material can be problematic. All because the brain is really doing what it was supposed to do to manage the threat that the child has been exposed to. But now when we look at it in a new situation, if we don't consider that threat, it can really look a lot like ADHD.
Mm-hmm. Mm-hmm. So I'm just curious from a parent's perspective, if I go to the pediatrician after I've been in school with my son or my daughter and there's some struggles in school and the school says maybe you should connect with their pediatrician about the symptoms, should I also be talking a little bit about what they've experienced in their life too as I'm speaking to my pediatrician?
Absolutely. It would be really important for the physician to have that perspective as they are trying to evaluate that child for ADHD, because some of the questions can be answered that as a positive for ADHD unless you understand that there's been a trauma exposure as well. And in fact, kids who have had exposure to trauma may also have ADHD. So it speaks to there it speaks to the fact that we may need to be dealing with ADHD issues, but we also may need to be rethinking how much treatment the child needs to continue to have once they've had some trauma treatment as well.
So on the flip side, as a parent, I should probably be talking to the school a little bit also, not only about kind of what they've been going through, but also what the symptoms they're seeing in the classroom might be around as well, beyond maybe the diagnosis of ADHD.
That would be so important, because also in the school setting, if a child is being triggered, their symptoms may be getting worse and more aggravated by that school setting. If the child is in a situation where, as the noise in the classroom gets louder, they feel more threatened, that may be putting a child into a fear state, and the teacher may be misinterpreting it as ADHD or anger issues, but in fact the child is really just responding based on the trauma. So having the teachers and the administration at the school understand what your child has been through and what you're looking for, and then also helping them to understand how they might better respond to your child. When the child starts to get upset or distracted, having the child be brought to a place which is quieter, or having the teacher speak to the child in a quiet way may be more useful, and maybe something that the teacher hasn't thought of, because that's not how they would respond to a child who had not been exposed to trauma.
Okay. So it sounds like what you're saying is it's important, the more information we can give the pediatrician about what they've been through and what we're seeing and how it kind of interacts in school or at home, probably the better. And in the flip side, to be making sure we're speaking of that to the school too, so they can see what is happening in their own school that might be triggering the child as well.
Absolutely. And then the last piece is just continuously reassessing that even if we decide that a child does have features of ADHD that need treatment, to recognize that for a child exposed to trauma, we don't want to place that label on the child and walk away, but we want to come back and visit it again and say, okay, after trauma treatment, are these symptoms still there? Do we really still have ADHD that needs that kind of treatment?
Okay. Well, thank you so much, Dr. Forkey. We appreciate it.